Sometimes the patient might have a cyst. It could be a fibrocystic disease or a benign tumor, a fibroadenoma. In that case, the provider is going to remove the cyst or the fibroadenoma. So you need to know whether it is an open excision. So whether the provider is going to remove like one lesion or multiple lesions. So accordingly we have codes like 19120 and 19125. Sometimes when preoperatively they have placed the markers, so we call them as radiological markers or localization devices, we have a separate code. Okay. So coming here for breast biopsy and for localization devices, we have different code sets. So just placement of this localization devices, we have codes like 19281, 19282 when the provider is placing these devices under a mammographic guidance. So accordingly the code differs, whether it is stereotactic, MRI or USG, the code differs. So here the provider is placing the metallic wires under a mammographic guidance. He is placing like two markers. You should understand the number of markers is not necessary. Actually the number of lesions that are treated is necessary. Provider might place two markers in one site itself, but you will have to report only one code, which is 19281. When there are multiple lesions treated, then you can report the add-on codes. Same way for breast biopsy, whether, and this might include or may not include. So breast biopsy along with localization device, you can have 19081, 19082, which is for the stereotactic guidance. So this is plus or minus because breast biopsy, they say localization device when performed. Hope you all know what is the meaning of when performed. It is not necessary or it is not mandatory.